Actually, I'm half-time with this campus and half-time with the HSC, which makes for a very schizophrenic personality. So, but I'm going to talk just briefly about a topic that I have now a One Health class I'm doing with the Honors College, thanks to Dr. San Francisco. It's to talk about health is to talk about a complex system that there is really not the ability to do predictive analysis. I've been 20 years in the military and many places throughout the globe, and I'll never forget the first time I was asked to think about One Health. I had a phone call from a colleague of mine in Thailand. He said, "What do you know about dengue hemorrhagic fever?" I said, "I know nothing." What can we do from a behavioral perspective to change our outbreak dynamics in Bangkok? I said, well, I better be a fast learner. So those of you who have served in the military know that there have been global infectious disease network the military has relied on for many, many decades, and now they're much more capable with civilian military capabilities such as our laboratory response network. And here at TI, we've got a capability that also looks closely at zoonoses and environmental factors. So one of the things I try and teach my students is to recognize the interconnectedness of One Health. And many of you are probably aware of this. I've had the good fortune to work closely with Bruce Kaplan, Laura Kahn, and the other organizers of the One Health Initiative to try and propagate this understanding about systems and complexity and the interconnectedness of many things. I lived in New Mexico during the hantavirus outbreak, and it became very clear that not only there are sentinels for disease outbreaks, but also there are times when all of the evidence goes underground. In other words, you have no clue to when the next outbreak will occur. I worked with Terry Yates and and Brian Hella at University of New Mexico when they started their web-based approach to understanding rodents as sentinels for disease outbreaks and trying to understand the different biomarkers and something called Refugia that was coined by many, but Nitin Kenkri wrote a great article, and I'll leave a few copies, that talks about the interaction, the dynamics between the reservoirs of disease, climate, spatial and geographic determinants of disease outbreaks. Kind of like from a perspective of a forest fire. You can have all the elements present, but you need that essential combination within a system to have that outbreak or the spread of a fire. Zoonoses, many of us are aware of. I've worked on the bioweapons side of this for most of my military career, which means you're talking about at least 85% of bioweapons are zoonotic diseases. And, sorry about that. Well, you guys know it all anyway, so. But if you look at this, interesting, 60% of the estimated 1,451, probably much more than this than from the time that this was published, can infect both humans and animals. And when we look at globally, the determinants of what are disease outbreaks, our understanding now of a global network of disease and outbreaks is far more sophisticated than it had been in the past. Very famous article that many of us quote who work in the One Health field that really, I think, schematically is a great way to start thinking at a fairly high level about the interaction of the various systems. And what I like to think about is the dynamics of this complex system, how every one of these interfaces changes on an ongoing basis. At one point in time when you could predict when an outbreak of West Nile virus might occur in the United States, that will change. I worked with a gentleman named Dr. Dana Fox, who did sea surface temperature calibrations. And when we worked with the state of New York back in the year 2000, we started looking at sea surface temperatures El Nino and La Nina variables, and also trying to have some prediction in terms of when would we see the next outbreak of West Nile virus. And Dana Fox has published extensively in this area, but I started getting a much greater appreciation for the interaction between climate and the determinants of outbreaks very early on in my career, and I try and impart that to a lot of my students. When we think of the list that the Institute of Medicine published back in the early 90s, we think of how much more extensive this list is now. Emerging diseases as new, re-emergent, or drug-resistant. Now there's a big call that's going to come out of USDA or NIFA that will have to do with antimicrobial resistance worldwide. And I think this is one of the great challenges of this century, that we will have to more effectively understand how the prescribing of antibiotics, the pretty much ubiquitous use that ends up in the environment as well, water sources, etc., influences disease outbreaks and reemergence. And in the last 3 decades, there has been incidents threatens public health. Now, what are the major contributing factors that we start thinking through? You would think, well, probably many things are man-made, but also many things are naturally occurring. So in terms of quantifying these things, it's a highly dynamic system. When I worked at Sandia National Labs, we did some of the first use of models using genetic algorithms to predict outbreaks of disease. And you know what? Even having high-performance computing capability, many inputs to the system, we were still only about 65% effective in predicting outbreaks over a 95 or 90-day period of time. So these are some of, clearly, the determinants of that contribute to emergence of disease. I think of this list, some of the most important for many of us who work in the global scale is lack of public health infrastructure worldwide. Obviously, war, acts of terrorism are significant, but really a lot of it, I think, in terms of changing ecosystems and understanding the significance of climate and weather are also key. On the human vulnerability, I'm not only talking about immunocompromised individuals, but also the vulnerabilities that come from displaced populations, ones that have very little in terms of nutrition, little infrastructure, little in terms of a commitment to public health in the region. Also these mobile populations and the extremes in health as well, and their susceptibility to disease that's indigenous in their regions. For example, now we're very concerned about continuing concerns on MERS, Middle Eastern Respiratory Syndrome in the Middle East, the source of which is camels and aerosol spread. So what I've tried to do is just talk a little bit on a very high level of the many interacting factors. What I'm trying to do with the students that I'm working very closely with now is try and create environments in which we can test and evaluate emergence and reemergence of disease. We hope to compete very effectively for working with some colleagues in the UK, use of microarrays in the field to test and evaluate emerging and reemerging diseases in feral swine in Texas. And this not only will look at the significance of the host, but also the variable conditions that either promote or also mitigate the outbreak of disease. So I'm involved in many things. Any of you who have worked with me understand that, and probably that's the challenge these days, is working in a multidisciplinary environment. So be happy to answer any questions. I think I'm pretty good on the 10 minutes.
You are, very good. Questions?
I have a question. What's in the news right now is the Ebola virus.
Yes.
And there was a book that came out, I don't know, 20 years ago, The Hot Zone.
Mm-hmm.
And now it's out, you can understand again. And I had read that, and I just skimmed through it, and now there's, the question of the vaccine for Ebola.
Mhm.
And that would be my second question. My first question is, when I skimmed through that book, I saw things like Assault Cave, SB40.
Very early
what is-
on in the
what is
discovery.
What can you comment on that? I mean, what did that book say? How is it relevant?
In terms of the initial detection and identification of the virus?
And then what to do about it today in terms of the vaccine?
Well, today, and again, it gets down to basic principles. There are at least 5 species that we know about. Ebola, the vaccine trials that are underway, we believe has pretty good efficacy against Zaire, which is the strain that we're most concerned about in West Africa right now. In terms of, Ebola is the type of virus that is highly infectious, but has moderate contagious nature to the virus. So what that translates to for day-to-day interaction with viral spread and prevention of spread is that personal protection is critical. For the cases that we had, the healthcare workers that did get infected, to include the nurse in Texas who was infected, it all traced back to lack of discipline in use of personal protective equipment, specifically the removal of the equipment. So Mr. Preston in the hot zone, some factual parts of that particular book. Some of it was written based on some scientists who were from the former Soviet Union who did have experience working with genetic engineering of Ebola. But in terms of, today's real thrust is, number one, discipline and personal protective measures. Number 2 is use of the vaccine. And number 3, we're trying to influence a cultural shift with anthropologists in Africa, trying to influence the burial practices of individuals who have passed. Yes?
For someone that has very little understanding of how climate can affect disease transmission, if that's the right word, could you give an example or two of how exactly climate factors could affect it?
Well, I gave one, which was West Nile virus, that we know that the outbreak did track somewhat with the climate changes. And there are people here who are much more expert in climate than I am, but we did see the variation with El Nino, La Nina, and the resulting shifts, even by a couple degrees in sea surface temperature with outbreaks that occurred. So, and maybe someone else might have a comment on that, but that was a very clear example.
It affects the abundance of the carriers, right?
Yes,
Yeah.
So let me see, a good example then for hantavirus in New Mexico in the desert Southwest was it came back to climate issues, more rain, better sources of food for the rodents that were the carriers, and this then the source of food for ultimately the vector that ended up with the initial outbreak in the Four Corners area in the native Navajo population. But like I said, you have all these things. You have, the nidus for infection, but then to have the practices that resulted in the exposure. And the first case, the individual passed from acute respiratory distress syndrome because of the confinement of that individual in a hogan when they were actually sweeping the the refuse from the rodents in a confined space and inhaled.
I think we have time for one more question.
How's your class going?
Oh, really well. And, these are students, they're 18 students who are One Health students, and they get really excited when today they had a talk on biosafety when we start making it relevant to them. So when we start giving them precise examples, but they're all worried about their midterm exam. And I said, don't worry about the exam, worry about how you think through a problem.
Yeah. Great. Thank you.
Thank you.